Good afternoon and welcome to today's session of The True Normal. I'm Christelle Pansegrouw, Director at VanderMerwe&Robertson Attorneys. May I please ask you to keep your video switched off and also mute your microphone during the session, and remember to unmute if you want to ask a question. You're free to submit any questions during the session and we look forward to receiving it and we'll try to answer most of them. We're also recording the session and we'll distribute it to all the participants tomorrow. Not only does our business have to adapt to a post-COVID society, but also our families, including our children. I believe that nothing in life is to be feared. It is only to be understood. Now is certainly the time to understand more about the impact of COVID so that we may fear less. Now, I'm a working mom with 2 kids awaiting anxiously for their turn to return to school. I'm therefore looking forward to listen to today's guest speaker and have the privilege to welcome and introduce Dr. Fiona Kritzinger, a well-known paediatrician and paediatric pulmonologist from Christiaan Barnard Memorial Hospital. She indeed has a very impressive CV. She graduated cum laude from the Stellenbosch Medical School and received the Chancellor's Medal for her academic excellence. She did a pediatric specialist training partly in Brisbane and partly at Stellenbosch University. She graduated cum laude with a master's degree in pediatric medicine and received the Robert McDonald Medal for the College of Medicine in South Africa in a final pediatric exam in 2006. In 2009, she received a Sky Foundation scholarship and was accepted as a fellow in pediatric respiratory medicine in the hospital for sick children to further her studies at the University of Toronto. In 2010, she returned to Cape Town to start the Chest and Allergy Centre at Christiaan Barnard Memorial Hospital, where she currently operates from. Then I would also like to welcome especially all the school principals that are joining us today from various private and public schools all over the country. And also Jannie Kruger of Dorpstraat Properties, who will conclude this session. Now, I hand over to Theo Vorster, Director of Galileo Capital. Welcome also to you, Theo. Theo needs no introduction, and he will facilitate the discussion this afternoon with Dr. Kritzinger. Theo, thank you again for joining us, and you have the floor.
Baie dankie, Christelle. Ek wil net van my kant af, I just want to say thank you, Fiona. I actually know the family quite well, and I always am impressed with the fact that it is a medical family. Not only is a father a doctor, but siblings are medical specialists, are medical doctors, and I have a lot of respect for them as a family and for Fiona in terms of her knowledge base and contribution that she is making, especially in these very, very difficult and unfortunate times we are in now. So Fiona, thank you very much for coming to us to talk to us. Before we got online, I just noted something that for me is quite outstanding, and that is the fact that if you look at politicians and then the media and you look at their comments, they always want a number, they want certainty. But if you talk to academics, if you talk to doctors, if you talk to specialists, it's a lot more complicated, and there's almost a humility when they talk about these things, almost a kind of a humility in terms of there's uncertainty, it's a difficult situation we're in. So I would like your views, and we certainly look forward to it. I will allow, after Fiona has spoken, I will allow a number of questions, and we see how the time goes. But first of all, Fiona, welcome, and we really look forward to your discussion.
Thank you for the opportunity, and thank you to the organizers. Can I just ask, does everybody else also just see the slide, the welcoming slide on their screens? Or can you see each other?
I think, Henry, can you just make sure that we enlarge? Yeah, there we are. Thank you very much. There we are. That's better. Thank you.
Yeah, no, it feels very stupid to talk to your cell phone with one slide. But thanks for the opportunity. And it's an honor and a privilege to share some of my thoughts on the facts and the fears of COVID in children. And I really have no disclosures to make other than to say that I am not a COVID scientist and I'm by no means an expert, but I am a clinician who aims to interpret the literature and then try to put it into a clinical context for my patients and my families that I work with. So as of last night, we have 7.5 million people infected around the world with COVID, 2 million of those in the USA alone. 54,000 people are critically sick and seriously sick, and 400,000 have unfortunately died. But what you don't necessarily see in the media is that 3.7 million people has recovered of COVID infection. So in South Africa, we are number 22 in the world, and we have 55,500 cases and 1,200 deaths. And that's usually the type of numbers that we all wake up with every morning. We get an update, we look on the worldometer, we get our News 24 feeds and social feeds. But how does that relate to children? What do we know about the risk of acquiring an infection in a child? And there the data is actually very positive and very reassuring. So we know that so far, of all the countries that have reported their cases, only 1 to 5% of all reported cases across the world has been in children younger than 18 years of age. So as a child or a young person, you at least have a 56% lower odds of being an infected contact. So in South Africa, they've reported 1,900 children positive with COVID, which means that only 3.5% of all cases in South Africa is currently in the age bracket below 19 years of age, which translates to an incidence of 15 per 100,000 population. So for biological reasons that we're still trying to understand, children are definitely protected against COVID infection, and they are less likely to become infected. So at the start of this pandemic, when we didn't have any data, we as medical people made certain assumptions. And one of these assumptions was that children will be super spreaders of this infection. And we based this assumption on the fact that we know that it's true for influenza virus. So we were all pleasantly surprised when the data started to show the complete opposite. When you look at the studies that has looked at transmission of the virus from a child in a household, the data suggests that children are very rarely the index case in a household, and that they very seldom lead to outbreaks in a household or in close contacts. So some of the studies that was done in China originally looked at 31 households and found that in only 10% of these households, a child was the index case in the household. Another study looked at 419 households, and not in one case was the child the index case. And then lastly, there's an Italian cohort that looked at hospitalized children, and that found that 2/3 of these children had a parent with symptoms, and that in 75% of cases, the symptoms in the parent or in the relatives preceded the symptoms in the child. So children are not the ones responsible for the spread in a household. But what about outside the household? And what about schools, for example? And again, we were pleasantly surprised when case after case was published to point towards the fact that children are very limited in spreading COVID from one child to another child, but also from a child to an adult. So, for example, you all know that the schools in Sweden never closed and never had a hard lockdown, but there hasn't been any published outbreaks in any of the Swedish schools up until the middle of May when they reported their data. There was a case report of a 9-year-old boy who went to 3 different ski schools in the French Alps and was in contact with 112 other children, and not one single child became infected or became unwell. And then there's by now also the well-known study in New South Wales. Again, in a school, there was 9 children and 9 staff members who were confirmed to have COVID. And they were in contact with 735 students and 128 staff members. And of all of those contacts, only 2 children became positive that could have possibly been infected at school, and not a single staff member became infected. And then recently, Ireland also reported their 6 cases that was identified before the lockdown. They had 3 teachers, 3 children in a primary school that was infected. They traced more than 1,000 contacts, and there wasn't any single secondary case. So all the assumptions that we made based on no science other than what we knew from influenza outbreaks, one after the other is being shown to be incorrect assumptions when it comes to children and COVID. So children are less likely to be infected, and children are less likely to spread the disease. But if they do get infected, what happens? What type of symptoms do they have? And how serious is it in children then? So we know that in terms of symptoms, it's fairly similar to what we see in adults. The most common symptoms are still cough, a sore throat, and a fever. But interestingly enough, only about 50% of kids will present with a fever. So those thermal scanning that's being done in all the schools and thermometers may miss cases. So it's not an excellent screening tool, and one would have to look for other symptoms other than just fever. Interestingly enough, about 10% of kids can also present with gastrointestinal symptoms like vomiting or diarrhea, or just being tired. And very few actually have a runny nose, which is also interesting because in most other viral infections, children often present with a runny nose first. And what was reassuring to see is from the Chinese data, is that only 2.5% of children presented with low oxygen levels, which again is very different from what the data suggests and what we know for adults. And I guess then the biggest thing that every parent that I've spoken to fear is, will my child be the one hospitalized, or will my child end up on a ventilator in an ICU, and will my child die? And those are obviously very relevant concerns. And I'm pleased to say, and we are all from a pediatric community delighted that that is the case, but children have a much milder disease than adults, and deaths in children are extremely rare. So again, looking at the Chinese data, they looked at 2,135 children. Only 1 child died in that cohort. The most of them had mild disease, and only about 6% needed hospitalized care for severe or serious symptoms. When you look at the Italian data, at that stage, Italy had 140,000 cases, and there were 17,000 deaths in adults. And that study that was published, there was only 2 children who needed ventilation, and both of them recovered, and they didn't have a single death reported in that cohort. If you look at the UK data published middle of May, only reported 3 deaths in children under the age of 15, which basically translates to 0.007% of their 41,000 deaths reported were in children under the age of 15. Again, the US data in May, there was 9 deaths reported in children under the age of 18. But what is not reported is that during that same time, from January till the middle of May, there were 31,500 deaths in children unrelated to COVID. So COVID during that time contributed only 0.03% to childhood deaths in America. And at the same time, during the influenza season, they had already 161 deaths. So what about South Africa? What does it look like in South Africa at the moment? At the moment, 2.5% of all the admissions in South Africa is for children under the age of 18. And we have unfortunately reported 5 deaths. 2 of those were in kids 0 to 9 years of age, and 3 was between 10 and 19 years of age. But this translates to a death percentage of 0.4% of all deaths in South Africa was under the age of 19 years, which means that 99.7% of all children survived and recovered. So, I mean, I'm rambling off a lot of numbers and a lot of statistics, but I think what is important is to reflect, and the question I ask myself is, how does that differ if we compare it to other diseases or other seasons or other years? How much greater then is the risk for serious disease or death, for example? And what happens in South Africa every other day and every other year that we probably didn't take note of or received reminders of on our phones or woke up with news on News 24? So, for example, in 2017, there was an estimated 16,000 deaths of influenza in South Africa. 600 of those occurred in children under the age of 18. Every year in South Africa, 2,000 children die of malnutrition in hospitals, and another 10,000 die in the community who never makes it to a hospital. Worldwide, there is 10 million cases of measles every year, and 140,000 children die of measles, which is a preventable disease for which there's been a vaccine around for many, many decades. And then I'm surprised when parents still ask me whether they should vaccinate their child with the measles vaccine. And then lastly, in South Africa, 200,000 children die of tuberculosis every year, and 21,000 die of TB in South Africa every year, right? So I think when we talk about these stats and we talk about these facts, we have to remind ourselves that there is a context that we, for the most part, most other times, are extremely comfortable with, either because we are perhaps ignorant and unaware, or we've learned to ignore it or live with it and become comfortable with the notion that we can get sick and we can die. But for the most part, we are healthy and we live. So coming back to children then, we know that they have less severe disease, they infect less people, the chances of dying is extremely low. But is there any risks? Is there particular groups that we need to be concerned about? And there the data suggests that children under the age of 1 year, in other words, infants, seems to have a higher risk for admission. About 10% of them will require hospitalization. And then a lot has been said about comorbidities in adults: obesity, hypertension, diabetes, old age. And how does that relate to children is a bit unclear. There's only been 2 studies who suggested that certain comorbidities exist, but they've also found that your chances of being hospitalized is equal if you have or you do not have a comorbidity. But we as a pediatric society, looking at the data, suggest that children with severe immunosuppression, children with chronic organ failure or severe cardiorespiratory disease should be considered as higher risk and should be looked at carefully when decisions are made about their healthcare, and particularly in returning to school. Which brings me to my last point, and then I will pause for questions, and that is the whole commotion about, do we go to school, do we not go to school? So against the background of what we now know about the risks of COVID in children, the risk of infection, the risk of transmission, and the risk for severe symptoms or death, we look at the situation at schools and we ask ourselves, what is the data that closing schools help, that it helps to reduce transmission in the community and that it prevents deaths? And the reality is there is no data. There's no science to show that closing schools have any impact on reducing the transmission in the community for COVID. What we did is we modeled it again on the basis of influenza, where we know children are super spreaders. And we said, okay, if it works for influenza, it will also work for COVID. And then hence the schools were closed. What we now know is that that's not true. And some of the modeling studies done in the UK based on the Chinese data suggest that if you close schools, you will only at best reduce the death rate in the country by about 2%. But what are the risks of closing the schools? What are the negative and adverse events? We know there's psychological and emotional impact. We know that only about 20% of learners had access to online learning during the lockdown. So most of the most vulnerable and the most disadvantaged children had no access to education. We know that these long-term economic effects of loss of education over many years that you do not necessarily always catch up. And lastly, but probably for me the most important, is that healthcare workers and essential workers have child responsibilities. And if they have to stay home to look after the children, they are not available to help in the hospitals and other essential services. So I guess lastly, what I would like to say is, and I think for me, that's the interesting thing that I've experienced over the last few weeks of repeating the data and trying to put the data into a context, is the question around how does the data actually change how we feel? How does it actually change what we do or what we decide and how we think about this whole thing? And is facts enough to allay our fears? Is it enough for us to feel reassured and comforted and to make other decisions? And I guess the question comes down to how comfortable are we to live a life where there is a degree of uncertainty and a degree of risk that we live with every day. But I think this pandemic has revealed a lot of inconvenient truths that we do not necessarily like to face or be reminded of. And I think as a parent and working with parents every day, the philosophical question is, when we look at data, Does that help us? Does it give us peace of mind? Does it give us a sense of calm? Because we must never forget that the children are taking their cues from us. And how we act during these times, these extraordinary times, is the message that they will take with them for the rest of their lives. So I'm happy to take any questions.
Fiona, thank you very much. I think it was incredible. And again, I just come back to the point that it is for me always heartening when scientists talk about these issues, in the sense the logic, the rationality, and if one cuts through all the noise and the difficulty, it comes down to very scientifically based elements, but also uncertainty about the outcome. So if anybody has any questions, Fiona would be happy to take the question. Just remember to unmute yourself and to make sure we can see you. So I'll be happy to take any questions. Please just remember to unmute yourself.
Hi, Doctor. Thank you very much. Very insightful. Do we have any idea why the virus affects so dramatically different older people as opposed to children?
Look, I wouldn't say we know, but there is certainly certain things that we are suspecting. So one of the things for children is, you may have heard about the receptor, the ACE receptor, that the virus used to bind to and to infect specifically certain cells, and specifically the endothelium. And it has been shown that children have less of these receptors. So it's possible that the infection load is different and lower. Some studies have suggested that the viral replication and the viral load is lower than older people. And then there's the theory that because children generally are exposed to more viral infections and the immune system is less mature, they generally have more viral infections. And it might be that some of these other coronavirus infections offers them cross protection. So they have circulating antibodies that they picked up from other coronaviruses that now protects them. And I think part of the answer is also that when you look at the comorbidities in adults, that is coming to the fore now, is that it does seem to be that those with the risk factors for endothelial damage or the lining of blood vessels, that they do the worst. So that's why the hypertensives, the obese, the diabetics, the older people, they primarily have an unhealthy lining of their blood vessels. And so there's more pathophysiology coming out saying that in actual fact, COVID is predominantly a vascular disease rather than a lung disease. So I think that those are some of the theories that's being looked at. For the most part, as pediatricians, we're just very grateful that that is the case.
Again, another question?
Hello, Dr. Fiona. Thank you for the opportunity. I would like to know, we've got new information now that when we decided to close schools, it was basically the wrong thing to do. So with this new information, if as leaders feel leaders should be able to make adjustments when necessary, are we talking to government to let the schools open quicker? In other words, the grades that still need to stay home for about more than a month and a half, are they going to come back easier or sooner or not? Thank you for the opportunity.
Yes, obviously, I mean, I have no influence over government. What I would, however, say is I don't necessarily think it's wrong to be cautious when we are in the beginning of a pandemic, and that we have to understand that the data we have is coming in every day, every week there's new data. Our situation in South Africa is a little bit different than the countries that I've quoted, like Sweden, Europe, the States, even South Korea. Obviously, our socioeconomic circumstances are different. Our populations are different. We are in the middle of winter, which also makes it a little bit different. And I think people, especially teachers and children and families, need a bit of time to adjust, you know, because of all the fear and anxiety that exists. It probably isn't a bad idea to grade people back into the school, to build capacity in schools, emotional capacity, and slowly but surely get back to the full. However that long that period must be, I can't comment on that. But I think it is a good thing that we didn't send all the children at once, and that we are doing it in a structured way so that we can monitor it, and that schools and staff and so forth can build their capacity to deal with it, because life back in the school is a bit different than before the lockdown. You know, there's lots of interventions that they have to put in place.
Any other questions? Well, Fiona, I think, thank you very much. There's another one coming in. Let's just quickly get that.
Good afternoon, Doctor. Can you hear me?
Yes,
I
we can.
Have you seen the information posted on the 8th by Dr. Jaco Loubser from Stellenbosch about COVID being predominantly a cardiovascular disease as opposed to a respiratory disease?
Yes, thank you for that question. Yes, I did. And I saw the video as well today that he posted. I think that is a theory that has been growing, and the data again has accumulated. And I think from the beginning, clinicians suspected that there is more to it than just a respiratory illness, purely because our experience with respiratory illnesses is there's a particular pattern that by the time your oxygen levels drops, you will look and feel very uncomfortable. And I think the striking experience that physicians had was that you would find patients who visibly looked not distressed at all or uncomfortable, but yet recorded very low oxygen levels. And that is obviously a specific phenotype or a specific group of patients. Again, I would caution again trying to be too absolute about things. I wouldn't say that it can't be a respiratory disease. I just think that there is certainly a group of patients, and probably those with the more severe symptoms, that has evidence for vascular disease with it, that also needs treatment, and that obviously needs a different strategy than a typical respiratory illness alone or a pneumonia alone.
I mean, what I thought was interesting about it is that we here, especially in the Cape, well, in South Africa, but in the Cape, have this problem where the virus is taking hold in densely populated informal areas where social distancing is virtually impossible. And the government is doing what it can, but we don't have access to the tests. And this, one would have thought, might have been a breakthrough for less expensive or more widely distributed treatment. Because, you know, clearly, like we've seen in New York, we don't have the ventilators. And it turns out that the more one goes into it, the less the ventilators seem to be the key bottleneck. And we're finding other solutions. So I thought that was quite positive.
Yeah, no, I agree with you. It obviously offers other treatment strategies and supportive strategies that is going to be helpful, and it's hopefully going to avoid having to ventilate people. I think there is definitely a recognition that what was thought right in the beginning to be just a pneumonia and an ARDS that required only very high pressures of ventilation is not the case, and that there is lots of examples of patients who improve just with oxygen therapy. And I think governments are aware of that, and it's good news for us in South Africa that you don't necessarily need just ventilators. As you rightly say, we have a shortage of that. I don't think, however, the treatments that were suggested in that video is not necessarily cheap either. But you know, and they do require close monitoring and all sorts of things. But nonetheless, I think it is important to take note of that.
So I think that your talk is very important for a lot of young parents, and we should do what we can, certainly within our community, to make it more broadly available and reassuring about the lesser exposure of children to it, because people are obviously very concerned about their children. Thanks very much. It was fascinating and well researched. I was impressed. Thank you.
Thanks.
Thank you very much. Thank you for the question. Just note that this will be emailed to all the participants. I see there's any other questions. Christelle, do you have a question or two, or what would you like?
I've got a question. So very plain and simple. So my child is now tested positive. What do I do? And then also in a second instance, I just want to ask you, there's a fear to take our children to the doctor for any other sickness or health, and you know, to stay away from doctors. If you can just maybe comment and reassure everyone on that.
Yeah, no, thank you for that. So firstly, if your child displays symptoms of COVID and there isn't any serious symptoms, for example, serious symptoms would be considered a child who is clearly short of breath, who's had labored breathing, difficult breathing, who's confused, who can't drink enough to sustain their hydration. Those children obviously do need to see a hospital and a doctor very urgently. Everybody else who has a cough and a sore throat can be managed at home. They do not necessarily require any treatment other than the normal love and care and Panado that you would use for all other viral illnesses. The only thing that we recommend is stay away from non-steroidal anti-inflammatories like Nurofen and Brufen, because that's been shown to potentially be harmful. And beyond that, if your child falls in a high-risk group with a serious underlying condition, the best would be to get in touch with a regular specialist and discuss whether anything else in addition is necessary for that child. So coming back to going to doctors, and that's probably from a pediatric community especially, but also the broader medical community, we are incredibly concerned that because of all the focus on COVID and even in our hospitals, the extreme precautions and all the effort that's been put in to manage COVID-related medical problems is to the detriment of those who do not have COVID, but have other conditions that still require medical care and close follow-up, especially even now during the COVID. So for example, children with respiratory conditions, children with cardiac conditions, children with diabetes, we need to make sure that their chronic conditions are well managed and well controlled, because that's the factor that's going to determine whether they will have a mild illness or whether they're potentially more at risk for more severe symptoms. So what I can say from the medical fraternity is that we have taken all necessary precautions to make our offices, our waiting rooms, our surgeries as safe as possible. And it's certainly safer than going to the shop to buy your food or the liquor store on the 1st of June. So the point is, I think it's important, very important for parents and children, and for that matter, all people, to not neglect their health care during this time, and to make sure that the symptoms for other conditions is as well controlled as possible.
Thank you. Thank you very much, Fiona. I think that was quite an incredible discussion, your research, your knowledge, and I wish you all the best. I think it is still going to be a difficult time. It's going to take quite a while. But from my point of view, I just like to say thank you very much. It was truly enlightening. Any last comment you would like to add or make as a passing shot?
Yeah, no, I think I just from a pediatric point of view, I just want to remind parents and reassure parents that we are here, that we are available, that if they have questions or concerns, we are happy to support them and help them. And I honestly believe that they need to take a deep breath and focus on what they do know, focus on what brings them hope and calm, and also portray that to their children during these extraordinary times, because we will prevail.
Fiona, thank you very much. And again, thank you very much for taking this time, for giving such a thorough discussion. And I hope it gives us a much more, it makes it easier to make decisions. It's sometimes a guy that I doesn't quote often, but I think I'll quote him, is Captain Jack Sparrow from the Pirates of the Caribbean, who said, "It's not the problem that's the problem; it's the attitude to the problem that's the problem."
Exactly.
And I think parents specifically, it's not the problem that's the problem; it's the attitude to the problem that's the problem. So thank you very much, and we really enjoyed it. Thanks a lot.
It's a pleasure. Thank you.
So you can stay on if you want to, but we usually just do a bit of a 10-15 minute discussion on a few economic and political situations for the clients, for the people on course. I would like to start this discussion on the politics and the economy on a different page. And I'd like to start off with, we have next week, Tuesday, Youth Day. That's a date that I think we need to keep in mind, but there's another date that's almost more important than that, and that's a date of the 24th of June. That is the date that Treasury and Tito Mboweni have noted that they will be happy to present a post-COVID budget. Now, and this is the key message I'd like to discuss in the next few minutes. That budget will be a radical economic transformation budget. Make no mistake, it will be purely radical economic transformation. That is both sides of government, various sides agree to that, and that's what's going to be. It's a matter of how. So what I want to take you through is this is an index that shows the GDP per capita of the higher middle class countries. Now these countries include countries like Argentina, Brazil, Ecuador, Venezuela, Turkey, Iran, Iraq, Algeria, Indonesia, Malaysia, Thailand, Tonga, Fiji, Samoa. So it's Mexico. So it's a wide variety of countries, and we could always measure ourselves from a GDP per capita towards these countries. Now this is a graph that goes back the last 20 odd years, and it's the latest available figure. This is the GDP per capita of these countries, the middle income countries, countries that we will always be able to measure ourselves against. So what happened? We were, up until 2011, we grew with the same pace that these countries grew. So our GDP per capita held with these countries. And then around about 2011, 2010, we got a gift. Zuma gave South Africa a gift. What was that gift? That gift means that on a GDP per capita basis, we are where we were in 2008, and we incidentally are exactly where the rest of the upper middle income countries were. What's happened since then? Well, the rest of the world went very nicely. Now, the average of the upper middle income countries on a GDP per capita basis is 50% more affluent or richer than South Africa. We're all the way back to where we were more than 10 years ago, and the rest of the world has gone up 50% on a GDP per capita basis. Something happened here. We got a nice new president, and the government decided on two things. Number one, they decided that we will have the state as the driver for economic growth. And secondly, in 2011, the ANC decided that this will be the decade of cadre deployment. Well, that decade didn't go so well. The problem here is South Africa dropped the ball. And that's why I come back to the point that the next budget in South Africa will be the budget of radical economic transformation. But let me put that into perspective. What does that mean in the context of South Africa? Well, the context of South Africa is that there's a few schools at play. The first one is there's a pendulum between the two schools. On the one hand, we've got the Ysmagashula, Minister Patel, trade union focus that believes government should set rules, government should implement this, and government should control this new way going forward. On the other side, we've got the Titu Mboweni side, the Letshego Kanyago side, incidentally the CEOs of most of the SOEs, who believes that government will need to play a limited role and the private sector will have to drive this. So currently, the Cyril Ramaphosa's economic panel is struggling between these two schools. I believe that the Ysmagashula one is a absolute gravel road, whereas the Titu Mboweni one is a highway. And the question is, are we going to be on Titu's highway or are we going to be on Ace's gravel road? At this point in time, it seems that the president is fair and square on the side of us having a more of a highway nature than anything else. And that, I think, is where the important is going to come in. But are we seeing some benefits to where we are now? I just want to show the slide, which for me is very interesting, is the slide of the fact that after lockdown, there are certain countries that, or certain elements that are actually coming very nicely to the fore. If you just look at signs of recovery in terms of what happened post-lockdown, and this is a McKinsey's report of last week, if you look at this is the airline seat capacity, the blue line is what it was last year, and this is the line where we are now. So although there was a massive drop in capacity, more than half, it picked up to where it was. What we are not seeing is in the hotel occupancies. The hotel occupancies that was last year, this is last year, is taking quite a bit to hike on, to level off. So what we, on the positive side, it seems that if one does it right, there is an element that will assist you. On the negative side, it is going to take quite a while to get there. And I think that is what we will need to be very important and to note as where we are. So if we then look at where South Africa is currently, we will see that we are slowly starting to unwind our process, but unfortunately, it is going to take a long, long time. And perhaps I'm not sure if this slide was shown, but it seems that it was. So from my point of view, I believe that we are slowly getting in the right direction, but it is going to take a lot longer than anybody ever expected. And that's the long and the short from my side. Just one or 2 points that I think we need to appreciate, and that is that the South African public finances are in a terrible mess. And this mess is not going to get sorted in the short term. This mess is going to take a lot longer than anybody expected and that anybody ever thought it is going to take. So from my point of view, I think that there is a light at the end of the tunnel, but unfortunately, it is going to take long. We are seeing more and more signs that some of the stuff is coming back into the projection, but it is going to take, unfortunately, a long, long time. And just a red light. We're going to see the first signs of government starting to talk about radical economic transformation on Tuesday, and we will see that in the budget. But it's not the type of radical economic transformation that Jacob Zuma was talking about. Just 2 anecdotal pieces of information you might or might not find interesting. The first point is that in April, for the first time in our history, in the month of April, there were more John Deere tractors sold in South Africa than there were Toyota Hilux bakkies. That sounds interesting, but the bottom line is Toyota Hilux bakkies dealers were actually closed. And secondly, one of the big Bonsmara farmers had an auction last week. Around about 23 million heads of cattle, value of cattle were sold. And the interesting point is, although the average price for a bull was 122,000, 48% of all the purchases at this auction last week was new farmers. It wasn't your traditional commercial farmer, it was new emerging farmers. And I think that is positive news for South Africa where we are now. And that's it from my side. Any questions or any topics that anybody would like to address?
Theo, do you have any indication or any thoughts on where the rand's going in the near future?
All right. The rand was last night at some point, believe it or not, was 1640, just around 1640. It's again trading around about 17. The problem with the rand is if you look at the purchase price parity, the rand is still undervalued. But, and this is the big but, South Africa's government finances are in a serious predicament. On the one hand, income is down quite heavily, and that you know from the tax receipts that are handsomely down, and I'm not even talking about cigarettes and liquor, just purely because of lack of economic activity. One of the Aussie 40s companies, FDs, told me early in the week that they send a number up. SARS wanted the indication of their tax for this year, and they send up a number of 0. And SARS said, but that's impossible. You're one of the big constituencies in paying tax. And they said, well, simply, you closed us down. We need to see how big the dip is. So on the income side, government's under incredible pressure. On the expense side, there is a lot of expenditure going through the system that will still need to find a way to be financed. I do think we're going to take an IMF loan. I think it's if you look at the ANC documentation, it's only purely about the terms of the loan, not about ifs and buts. So that will assist, but then you have to repay it. And secondly, government is looking at structuring between an 800 and a trillion rand fund to assist us. That's part of this problem between the Ysmagashula gravel road and Tito Mbeni's highway, is where does the private sector fit into this program? My view is I think the rand is going to remain volatile. I do hope that we will see levels of stronger than 1650 at some point. It was there last night, but I do think it will be volatile between 1650 and probably 17 and a half. If I were to take money out of the country round closer to 1650, I'll be more than happy to do it. Between 1650 and 17, I'll be happy to do it because I do think we'll remain volatile for the time being. But trying to picture it where it will, I'd rather tell you that in 3, 4, 5 years' time, it'll be a lot weaker than it's now. In the meantime, it will be volatile. So I think we're going to see levels. Hopefully, we'll get another opportunity closer to 1650. I am not too sure. I think anything between 1650 and 17, I'll be comfortable with. Any other questions? Okay, then from my side, it was really enjoyable. I think we had Rolf, this is a big challenge. We had an incredible guest speaker today, and I think we will need to really work on this to keep that level. I think it was a great speaker, and I really enjoyed the discussion this afternoon.
Yeah, Theo, I wholeheartedly agree with you. I also learned a lot and a lot of thought that went into us communicating to us the value of children and how we need to look after them and consider the way forward. Jannie Kruger, can I ask you to do the necessary?
Will do. Rolf, can you hear me?
Yes.
Rolf, can you hear me? Yeah, Christelle, Rolf, thanks for that. I must say, from a very cold and wet Stellenbosch, I believe it's snowing in Ceres and in Sutherland, so really cold, yeah. I just want to say thank you for all at VanderMerwe&Robertson and also Galileo Capital for this great. This has now been the 11th week, and yeah, and it really is great for us to make sense of things. I really like what Theo said just before we started when he said. Jy weet, mense het ook 'n job om die volk gemaklik te hou en seker eers gemaklik te kry en dan gemaklik te hou. So hou baie daarvan ook. And yeah, and I do agree. Dr. Fiona Kritzinger as guest speaker, it's really quite reassuring contribution, and yeah, for our kids as well. It's just great to know that when it comes to the impact of COVID, that it can be as reassuring as that. And yeah, and then also just a special thanks to Theo. You know, Theo, you put in a lot of time and a lot of knowledge of yourself is going into this, and you share it in such a generous way, and also always very factual and very clear. So thank you very much for that, and for everyone that is dialed in, thank you, and all the best and stay safe. Thank you.
Thank you very much.
Thank you. Thanks, Jannie.